If somebody comes in and says, they heard about ustekinumab, and I was thinking Humira, adalimumab, if they don't have psoriatic arthritis, I'm fine. Fine, I'm not going to fight them. It's fine. The efficacy is about the same. The risks are about the same. I'm not going to fight you. That's fine. Good. But let's say you come in and you have rapidly flaring psoriasis and you heard about this pill. And I think Otezla, apremilast, it has to be in the discussion. But if you're rapidly flaring, it doesn't work very quickly. And even if you're not rapidly flaring, it works 30% of the time. 33% of the time. 75% improvement within 16 weeks. So I will tell people, if you want to try this pill that is safe, no increased risk of infections, I don't even have to do any blood work, I don't even have to check you for tuberculosis, but there's a 1 out of 3 chance you're going to get better, and there's other medications that within 16 weeks there's an 80% chance you're going to get better, then you make up your mind. You make up your mind. I understand you might not want to, go with the shots because you think they're more risky, but I'm telling you here that I'm giving you the data right up front. And don't be upset with me 16 weeks from now if you're not 75% better or even 50% better. According to the American Academy of Dermatology, it's important that at the very least, dermatologists attempt to make the diagnosis, because psoriatic arthritis 80% of the time occurs after the onset of psoriasis. So therefore, the dermatologist is at a unique position to make the diagnosis. And once you get symptoms, usually your cartilage has already been inflamed, and you better stop that before it involves the bone. So, making the diagnosis is probably the most important thing. Asking people at every visit, do you have any stiffness in your fingers or toes when you wake up in the morning or after you've been driving a car for a long time? Costochondral, sacroiliac, symptoms of plantar fasciitis that go along with psoriatic arthritis. Now, look for nail pitting, because nail involvement occurs 80% of the time in people with psoriatic arthritis and only 30% of the time people that don't. Ask involvement in family members, because there's a high association of psoriatic arthritis in family members. And once you make that diagnosis, then I think we have a few options. If the psoriasis warrants a biologic therapy, then treat with a TNF inhibitor. If after 16 weeks, the TNF inhibitor is helping the psoriasis, but not helping the arthritis, well, then you have a few options. You could add a DMARD like methotrexate, or at that point, you can refer to a rheumatologist. On the other hand, if you're left with an individual, or you start with an individual that has very little psoriasis and a significant amount of arthritis, I think having a rheumatologist treat from the get-go is a reasonable option. What I don't like that much is so many doctors involved when it's not necessary. Because if you look at the Casper scoring method, if somebody has psoriasis, if somebody has an inflammatory arthropathy, 98% of the time they have psoriatic arthritis. You don't need to do bone scans, you don't need to do ultrasounds. What I think you need to do is treat, see if their psoriasis is better, and see how much improvement they have in their psoriatic arthritis, so their symptoms. I think in the primary care arena, there can be some misdiagnoses because the differential diagnosis would include eczema, tinea corporis, pityriasis rubropilaris, pityriasis rosea, and some other cutaneous T-cell lymphoma, which is probably the biggest risk factor because you don't want to put somebody on a biologic agent who has a lymphoma. I'd say maybe in my practice, 2% of the time we might do a skin biopsy to verify psoriasis, although even sometimes when you can't make the diagnosis clinically, observationally, by morphology, the biopsy doesn't always help as well. Sometimes you get a mixed pattern between psoriasis and eczema. But I think most of the time to the trained dermatologic eye, almost, like I said, 98% of the time, you can make the diagnosis of psoriasis.